It's a small world, and I'm here every Tuesday answering your tooth questions. If you have a tooth question, comment below and I'll make a video answering it. I'm Dr. L, and this is Bite Bite. Today we're going to be talking about the Covid-19 coronavirus and how most dental offices around the country are open for emergencies only. What is a dental emergency during this time? I'll tell you more about that at the desk. Oh, hello again. So I was just telling you on the bike that our state board has clarified what is an emergency and what is not an emergency during this time with the COVID-19 where everything is shut down by the governor mandate. Let me show you that. This is the Louisiana State Board of Dentistry. Here is the order from our governor, Bill Edwards, that dental offices should only be open for emergency treatment for the next 30 days. And here is the clarification from the board, which is mostly a copy from the ADA recommendations. Why are dental offices open right now at all? Well, this is so patients who are having pain and true emergencies have somewhere to address them besides the emergency room. And I'd like to review some of these with you now. What's non-essential? What should you not have done right now? What, after watching this video, do you know not to go to the emergency room, not to call your dentist to try and schedule? Initial or periodic oral evaluation recall visits, including routine radiographs. Most of the things you have done at a normal 6-month cleaning. Routine dental cleanings and preventative therapies. Orthodontic procedures, other than those addressing acute pain. Extraction of teeth that don't hurt. Restorative dentistry, including treatment of asymptomatic carious lesions. If you have been told that you need a cavity, but it is not necessary to be done within the next 30 days to avoid a root canal, or you're having extreme sensitivity when eating or drinking cold water, something like this, it can wait. Anything aesthetic. They reiterate that it's up to the doctor at the end of the day. So if you're not sure after hearing what I've said, please call the office. Here is our phone number. If no one is here, because we currently have very limited hours, then feel free to call my cell phone number. Here it is. If you call my cell phone number and I don't pick up, please leave a message and I will get back to you quickly. There are also some important suggestions in here that will help prevent the spread of COVID-19 if a patient who has the infection and doesn't yet know it comes into the office. And these are things that we don't normally do, and with the craziness going on, it is possible that it might slip the mind of everyone. So if you're watching this video, you go to your local dentist and they don't ask you to do these things, it would be prudent on your part to request it. One of the things they're suggesting is swishing and gargling with a 1% hydrogen peroxide mouth rinse. It's just a little hydrogen peroxide with some water in it, swishing for 60 seconds, gargling for 60 seconds. This will kill the virus if it's in your mouth and prevent it from being spread in the dental office within the approximate hour that you'll be there. It won't cure the virus, but it'll help prevent its spread. If you have the virus, go to your dental office and keep it from going to other people. Use a rubber dam or high volume suction. A rubber dam is a green thing that goes around the tooth and is a physical barrier between the rest of you and the dentist who only has access to the tooth then. It has a clamp that goes over the tooth. A lot of us dentists only use it for root canals. I personally use something called an isolite most of the time, which is this special mouthpiece that has a whale tail that protects your tongue and your throat, and it hooks up to the high volume suction, so anything going on in your mouth gets down the system. I think this is a really great thing that will help people during this crisis. What about being in the waiting room? They are asking us to remove all magazines and toys from the waiting room to prevent anything that could be touched. They are also suggesting that we ask people to wait in their cars. So if you see other people in the waiting room, please let the staff know you are there, give them your cell phone number, go wait in your car. If you have your family with you, or you are a parent of a child who needs emergency treatment, then please, after you have checked in your child, you should go to the car and wait for the staff to call or come down and let you know that everything is finished. It's very important that we minimize the amount of people in the waiting room. And this is so that if anyone has COVID-19, does not realize it, comes into the dental office, it minimizes the risk of transmission. If you'd like to see us in a professional manner, here's our information. Again, we are open only for limited hours at this time for true emergencies only, to assist people who need something addressed immediately, and we do not want them to go to the emergency room. If you have any questions or comments, please post a comment.